Good morning, everyone. Thank you. Thank you for coming this early. And I appreciate you all being here. And also, we are joined by numerous community leaders and experts behind me. And I will start with Dr. Peter Hotis, co-director of the Center of Vaccine Development at Texas Children's Hospital, Fort Bend County HHS Director Dr. Minter, and County Attorney Bridget Smith-Lawson, District Attorney Brian Middleton, County Tax Assessor Collector Carmen Turner, and District Clerk here, Beverly's here? No. She will be joining us, and Shimi Javeri, one of our students, and of course our pastor, Starkweather. And there are others. Is anybody I missed? No. And I just wanted to say this, we are here after 17 months later. March 4th, the first COVID-19 case was identified in Stafford, state of Texas, first case. Since then, this is 17 months, and COVID is continued to be here, and now we are, and COVID is resurging back with the COVID-19 Delta variant. And that is actually, Delta variant was first discovered in Fort Bend County maybe a month ago. And we have already seen COVID cases in Fort Bend County is doubling and more than doubling every week, and that is very concerning. Standing with me today, you will see that a team of health experts, safety specialists, community leaders, and elected officials. As a team, we have assessed the risk factors to our community, which include our children, elderly, county employees, our families, and neighbors. The outlook: without vaccinations and mask, it doesn't look good. As a result, and Dr. Minter will be sharing specific details about this decision. And as a result, I am announcing that today we are raising our threat level from an yellow, which is moderate risk, to significant risk in Fort Bend County. We raise this level today because the data suggests that the threat of our community is even greater with a fourth wave of COVID-19 virus. Accompanying this change in level, I'm also calling on all county staff, please wear masks while you are inside especially, and encourage everyone, please go get vaccinated. And that is the only way we are going to address this issue. Beginning next week, we will be bringing back a screening, health screening at the entrance of all county buildings, and for employees, visitors, and others coming to our county buildings, even for services. We will also reinstate physical distancing, especially starting with our Commissioner's Court, which is going to be starting today. The challenge we are facing as elected officials is to determine the best way to keep our community safe, and whatever the best we can do to continue to support a normal life as much as possible. But it is important. This pandemic is not, we cannot take this lightly. And as you know, we came a long way in this, and we are doing so far well. That's the reason why we are proactively engaging to make sure this is not get out of control. And speaking more about Delta variant and its challenging situation in Fort Bend County, I will ask our Fort Bend County Health and Human Services Director, Dr. Minter, to come forward and give us some specific detail, what she's seeing, and also the impact of Delta variant in Fort Bend County currently. Dr. Minter?
Thank you, Judge George, and good morning, everyone. So an average of 195 new COVID cases were reported average each day during the last reporting week. That's an increase of 149 cases per day over the previous month, and it's more than twice the average new cases we reported the last week. Hospitalizations for COVID-related illnesses averaged 121 patients per day, which was an increase of 70 patients per day compared to the average for the previous month. The 7-day percentage of ICU patients being admitted for COVID stands now at 18.1%, which is an increase of 9.7% over the average in our previous month. Test positivity at our hospitals, the ones that report to HHS, continue to be in the double digits, approaching 20%. And the most current data we have show that at least 84% of the virus circulating in our county is of the Delta variant. As judges said, the vaccinations are one of our most powerful tools to end the effects of COVID-19. Currently, Fort Bend County has over 60% of our population vaccinated, but that means there are several more that need to be, many more that need to be vaccinated. Right now, the impact is seen in our hospitals, with over 90% of hospitalized patients with COVID in the Fort Bend hospitals being unvaccinated. We also have 96% of COVID-related deaths occurring in those who are unvaccinated. As the start of the school year is approaching, it's important to highlight statistics that are related to children. So currently, 16% of our cases are occurring in children ages 11 and younger. This group is currently not eligible to be vaccinated. 41% of our residents aged 12 to 19 have been vaccinated. Obviously, that range includes the children most often that are in K through 12 school, and those are eligible to be vaccinated. Our pediatric hospitals have been seeing a substantial increase in hospitalizations due to respiratory illnesses over the past 4 weeks. Our hospitals in general and our ERs are growing full again, and healthcare staff are once again being stretched to their limits to continue to provide excellent care to those with COVID and non-COVID illnesses. So what can we do? Local data continue to show that vaccines are effective at reducing severe disease and death, so we can get vaccinated. We also have local evidence from just a year ago that shows us that wearing face coverings, avoiding crowds with unvaccinated people, and practicing good hygiene those measures definitely reduce COVID cases, illnesses, and deaths. So we can wear our masks and we can practice those good hygiene measures. Fort Bend County residents can continue to make educated and compassionate choices that will benefit our entire community.
Thank you, Dr. Minter, and I appreciate all the hard work from day one you put into, and we have seen results of your hard work. We are in the top when it comes to testing, when it comes to vaccination, and we have, as Dr. Minter rightfully mentioned, we still have a long way to go, and that's why we need your help, community help. And at this time, I will actually invite, or we are very happy to have Dr. Peter Hotez. And everybody knows these days he is a renowned authority when it comes to vaccine and vaccine impact and things of that nature. I will invite Dr. Hotez to come and talk about the impact of COVID-19 and also COVID-19 Delta variant in our community. Doctor?
Thank you so much, Judge. It's an honor to be here. Although I have mixed feelings about being here, I'm here for all the wrong reasons, and that is that, unfortunately, COVID-19 has returned to the southern United States. You know, last year at this time, we were at the start of a horrific surge that went from the Southwest, Texas, all the way east to Florida, and all the states in between, with thousands and thousands of people losing their lives, and that's how we got to that horrible number of more than 50,000 Texans losing their lives over the last year and a half. And it looks like once again COVID-19 is back in the South. Right now, the worst affected part of the country right now is Louisiana, where they're seeing a massive surge, lots of hospitalizations and ICU admissions. although the flavor of the epidemic in the South is different because we have done a relatively good job of vaccinating older Americans. So the difference between Louisiana, which has one of the lowest vaccination rates in the country, versus, say, Vermont or Massachusetts, which has the highest rate of vaccination among older adults over 65, we're looking maybe 80% compared to over 95%. Where the bottom falls out in the South are among the young people. So, for instance, in Louisiana, we have about 16% of the adolescents vaccinated versus over 70% in the North. That's the big difference. Or young adults, 30 to 40% of young adults vaccinated. So what we're seeing is a different flavor of the epidemic where lots of young people are going into the hospital and even into pediatric intensive care units. And I think, one of the problems has been there has been, with all the anti-vaccine aggression and a lot of the fake talking points, one of the big fake talking points is, hey, if you're, this is an illness exclusively of older Americans. If you're young and healthy and go to the gym and take care of yourself, don't worry about COVID. It's absolutely not true. We're seeing lots of young people now going into the hospital getting sick, going into ICUs, and then about 26% of the adults are going out to develop long-haul COVID, meaning symptoms lasting over 6 months, and we don't know how long that goes out, including cognitive declines, neurological impairments, and that you can actually see brain degeneration on MRIs. And so that's the message. Right now, Fort Bend is not looking terrible compared to the rest of the South. But I think our time's going to eventually run out. I think East Texas is about to get hit really hard because the vaccination rates are ridiculously low. Fort Bend is doing better thanks to the leadership of the county judge and the doctor and others here. They've done better than most, but it's still not where we want to be. So yes, we're getting up to about 60% of the county vaccinated. But with this Delta variant, it is so highly transmissible. It is 2 or 3 times more transmissible than anything we've seen before. What that means, practically speaking, is when that level of transmission goes up, the requirements to vaccinate to stop transmission commensurately go up. So to really stop this virus, we need well over 80% of the county vaccinated. And if we have close to 60%, the gap, back of the envelope calculation, 20% of the county vaccinated. So when you're talking about what's the population of Fort Bend, about 850,000, 860. So, we're realistically talking about we have to vaccinate 200,000 people in the county as fast as possible. And it essentially means all of the unvaccinated adults need to be vaccinated, and all of the unvaccinated adolescents need to be vaccinated. And I'm particularly concerned about the unvaccinated adolescents because all of this is happening before school even begins for in-person classrooms. And that, if our past experience serves us well, means it's going to act as an accelerant. Things are about to get even worse as schools start to open. So if we're really committed to in-person classes, this means in the middle schools and high schools, all of the teachers, all of the staff, the bus drivers, all of the adolescents need to get vaccinated and wear masks in the classroom as well. And for the little kids, we don't have vaccines. Little kids under the age of 12 are not eligible yet. Our best backstop is masking. So again, all of the kids, all of the teachers. And what we've got to do is be able to push back on the fake stuff. We've got to stop this nonsense of health freedom, medical freedom. We've got to save lives because right now, as we speak, in New Orleans and other cities in Louisiana, we are seeing pediatric intensive care unit admissions mount up. And if we're serious about protecting our kids, it means getting everybody vaccinated, everybody masked. And it's just simple science. It's not ideology. It's just the God-honest truth. So thank you so much for having me, and maybe hopefully we'll have some time for questions later on.
Thank you. Thank you, Doctor. Thank you for being here. And as we mentioned before, obviously, we really need to, all our agencies need to come together, and human life is actually #1 priority. I don't know how do you put a price tag on a human life. And so that's the reason why we took in Fort Bend County, COVID vaccine, COVID management seriously. That's why we got where we are. We have some of our neighboring counties are at 34%, 33% vaccination. So we are far ahead, but as Dr. Hortus mentioned, we need to go far, even further. Maybe 200,000 people need to be right away vaccinated. That's the reason why we are calling on people. Please, and those who are not vaccinated, I ask you, help us to help you, or in other words, participate in your own rescue, please. And we want you to get vaccinated. And obviously, we have so many, orders from Austin is actually tying our hands to do the right thing. And that's the reason why we need to get creative to address this issue. And so take it further. I will ask our county attorney, Bridget Smith-Lawson, to come forward and speak about a little bit details of how we are going to be addressing these issues. Please.
Thank you, Judge. Good morning. I'm the county attorney for Fort Bend County, Bridget Smith-Lawson. My office is charged with providing legal support, legal guidance to not only the county judge, but to all of the elected officials, department heads, and making sure that the county does what it's supposed to do legally to protect and serve the citizens. We are well aware of the mandates that Austin has imposed in terms of limiting local government's ability to restrict the ability to impose mask mandates. However, we are constantly evaluating the authorities that the county has within its constitutional duties, and also within its realm of just protecting and serving our citizens to make the best decisions and create the best policies to protect Fort Bend. Now, we all know that if something happened in our neighborhoods, we would, in terms of crime, we would want to be responsible and vigilant and contact law enforcement to protect not only our neighbors but ourselves. And this is what this is about. This is a collective duty that we all have to protect ourselves and each other. The wearing of a mask and also getting vaccinated will go a long way to protect everyone, from the oldest to the youngest, if we all would just comply. This disease is not a political issue. It is a disease, just like polio was years ago. And we have to approach it from a science-based approach based on the advice from our health officials. My office has been in direct support of HHS in Fort Bend County in terms of supporting vaccination sites and also testing sites and all of the legal support that's needed to make sure that Fort Bend County is safe. And my office will continue to do so, evaluating every step, the data, and also the needs of Fort Bend County, so that the legal advice that we provide Fort Bend does the best in serving and protecting Fort Bend. I know that Texas is vast, and the numbers and the data and the testing rates, vaccination rates differ all across the 254 counties. But we here in Fort Bend have to do what's best for Fort Bend. And with that, we will continue to evaluate this, continue to evaluate the laws, the policies, and what's best for Fort Bend, and provide the legal advice that's needed to serve and protect Fort Bend. Thank you so much.
Thank you, Bridget. And obviously, you all know that after 165 million Americans vaccinated, if you're still doubting about the efficacy, about the safety and things of that nature of this vaccine, I don't know what it takes. But please, this is as Bridget Smith-Lawson rightfully mentioned, and everyone spoke before rightfully mentioned, please take this as your responsibility, and let's worry about not just us, our neighbors, our family, and our children, and everybody. And so once again, let's save lives. That's the discussion here. And I'm also today, I just wanted to say a number of county departments, independently elected officials with the highest number of individuals working in their department. I reached out to all of them, and thankfully everybody came. And so I just wanted to hear from each one of them what they're doing to make sure their employees are safe and secured. And so I will invite our Fort Bend County District Attorney, Brian Middleton, to say a few words. Brian.
If you're like me, I got vaccinated earlier this year, and I thought, hey, this is the beginning of the end of this pandemic. And I was so looking forward to returning to life as normal as we knew it before the pandemic. But I realize now that hope is delayed and that we are still in the midst of a battle against this virus. You know, in America, we pride ourselves on being fighters, protectors, and we're in the middle of a war against a virus. Now, for some, it's not popular or comfortable to wear a mask, but this is our weapon. This is the arm that we need to bear to fight this virus. So let's all be vigilant and continue in this fight. Wear your mask, fight this virus so we can move past it, so we can get back to a semblance of life that we knew before the pandemic. I can tell you, as part of law enforcement, we have to continue working in spite of the pandemic. And oftentimes the people that we deal with are not practicing the best hygiene. So fortunately, employees in my office are strongly encouraged to wear masks, and they're doing it. They're protecting themselves, they're protecting the public, and we need your help. We need to control the spread of this virus, and we need you to arm yourself with a mask. Wear your mask, protect the public, protect yourself, and practice good hygiene. Thank you.
Thank you, Brian. I will invite, and so these all departments provide service to our residents. And so that's the reason why it's important. I like to hear how they're tackling the situation. I will invite at this point our tax assessor collector, Carmen Turner. Please come forward and say.
Good morning, Judge. Good morning. On Friday, we had 3 people in our offices to come down with the COVID virus. We shut down our Missouri City office. I know a lot of people are aware of it. We did a deep cleaning in the offices to make sure everything was straight. Right now, in all of our offices, we're requiring all our employees to wear masks. And every time a customer comes to the window, we asking them to actually wipe the windows down to make sure we stay on the safe side. COVID is real. It is very real. I have had my shots. We have had the chance of experiencing going through it the last time it came around. We lost a lot of employees then, and this time we're trying to stay on the safe side of it. So if you come in our office today, we're asking everybody to wear a mask. Like Brian Middleton just said, these masks are very important. It would help us and our family members. So we don't want to go down like we did before. We have an hour wait in our office majority of the time you come in now, and if we lose employees, we won't have anybody working there. So please be patient with us right now. We're trying to do our best to make sure we take care of everybody in our offices and on the outside of the houses. Thanks.
Thank you, Carmen. And I will invite District Clerk Beverly Walker. Please come forward. Beverly.
Thank you, Judge George, for the invitation. I am Beverly Walker, your Fort Bend County District Clerk, and we have always continually taken the virus seriously. We have worn masks in my office since 2020, and we've never taken them off. Even when we were told that we didn't have to wear them, the people in my office begged to wear the mask. Why is that? Because we were really hard hit in 2020. Several of our employees went out for days, months, weeks, and so there was no need to impress upon them the need to wear a mask. So in my office, you're perfectly safe. We've been wearing a mask continually for the last year and a half. We have plexiglass. Wherever we meet you, there is protection with plexiglass in the jury assembly room, in the customer service booth. So we are prepared. We're taking it seriously, and I would advise all of you to take it seriously. The virus is serious. And please know that when you come to the district clerk's office, you're going to be protected. Thank you so much.
Thank you, Beverly. And the Fort Bend County's largest department is Fort Bend County Sheriff's Office. And please come forward, ma'am. Please say a few words how you are preparing your department, because you have the largest manpower. Please go ahead.
Good morning. Thank you, Judge. And thank you for being here. So on behalf of Sheriff Eric Fagan, I am Maddie Provost, the Chief Deputy for Fort Bend County Sheriff's Office. And as has been said already, we have continued to wear our mask also. Not everybody in the office, but we have actually felt the effects of this Delta variant. We have several people that's out right now. And in our detention center, it has always been mandatory to wear the mask, but sometimes people get laxed, and so we are feeling the effects of that. So we have already started sending out emails and encouraging our employees to wear their mask. It's even more so important for our sheriff deputies who are out in the public to wear their mask. Number one, they are the role models, and that's a sign for everybody else to put their mask on. So we are highly encouraging everyone to continue to wear their mask so that we can try to beat this Delta variant of the coronavirus. Thank you.
Thank you. And as we discussing this issue, continue to discuss this issue, to make the matters worse, in a couple of weeks, our school districts are going to be opening. And I've been receiving a lot of calls because I used to be a Fort Bend ISD trustee. I know a lot of parents. They are asking how do we deal with it. Honestly, a lot of parents are scared what to do. And I believe our leaders should take decisions to benefit and not put fear in people's life, and benefit and keeping some kind of safety feeling to our citizens. And it is unfortunately the other way it is happening. And basically taking away the school districts, municipalities, and also county and all local organizations' ability to manage this pandemic. And that's the very reason why we are going through this round, comparing, as rightfully you mentioned, rightfully you heard from Dr. Hottes, the South is again getting, hammered by COVID-19. As you heard last night, our neighboring state, Louisiana, the governor issued a mask mandate statewide because it is that's maybe one of the way they can control this situation. So with that, and I'm very honored to have a student going back to school. And her thought and how she feel about all this is happening right now. I will ask Anshumi Javeri to come forward and say a few words. Anshumi?
Thank you, Judge. Hi, my name is Anshumi Javeri, and I am a high school senior. In 2 weeks, I and my peers will be returning to in-person learning, and I don't think I could be more anxious about that fact. This is going to be my first time stepping foot on campus for in-person learning since the shutdown began in March of 2020. My anxiety is made worse by knowing that while I am vaccinated and I choose to wear a mask, people sitting directly next to me may not, and their decision directly impacts my health. Once I received my vaccine, I was less afraid to go out and be around other people. But now that the Delta variant has began to spread rapidly, that fear and anxiety is coming right back. And knowing that we have no mask mandate or social distancing practices makes it worse. As young students, we may think that we have immunity to this virus given that we are so young, but this is not the case. As a student, I still have to be mindful about spreading the virus back to my parents, the elderly, my teachers, and all others around me. I am grateful that Judge K.P. George, along with other local officials are concerned about the health and the well-being of students and young people like me. I have to wonder, as a young person observing our state government, does Governor Abbott care about me and the well-being of students in our great state of Texas? I encourage everyone to please wear masks and to get vaccinated, not just for yourself, but for the safety of students just like me. Thank you.
Thank you, Aunt Shumi, and thank you for being here. And you heard from a student going back to school how they feel about all this thing happening. And I tell you this from March of 2020, when I'm dealing with COVID, I had to make numerous hard decisions. But one thing I tell you, the hardest thing for me to deal with was the politics attached to COVID-19 rather than COVID-19 itself. And so hopefully we get out of that mode, and there is nothing political about a virus which can kill people, and virus doesn't look at which side of the political spectrum you come from, and if you are not careful, you could die. And you have seen numerous cases of people regretting for not taking vaccine. And do you want it to be that next person sitting on that bed saying that, oh, I should have and could have done it a long time ago? So please, go ahead and get vaccinated. And of course, during this process, I always worked with our community leaders, which include one of the most important group of people are our faith leaders. And so we worked very, very closely when it comes to every aspect of dealing with COVID-19. And one of our strong supporters, always been available and out there helping and protecting and supporting, even also spiritually supporting our community, is Pastor Starkweather from St. Martin Evangelical Lutheran Church. Pastor, I will ask you to come forward and say a few words, and we will conclude with your, even maybe a prayer. We conclude this press conference right here. Pastor.
Good morning. As Judge George said, my name is Will Starkweather. I am a pastor in the Evangelical Lutheran Church in America. I serve St. Martin's Lutheran Church in Sugar Land, and it has been my joy to be a part of the Fort Bend Interfaith community. A couple of weeks ago in Commissioner's Court, I shared that the German reformer Martin Luther famously wrote that the Christian is a perfectly free Lord of all, subject to none, and the Christian is a perfectly dutiful servant of all, subject to all. Now, on the surface, those statements may seem paradoxical, maybe even antithetical, but what Luther understood is that every person has both liberties and responsibilities. I would say that what Luther said about the freedom of the Christian could be said of every American. We have many liberties, but with liberty necessarily comes responsibility. For the past 18 months, the COVID-19 pandemic has changed our way of life. Our faith communities here in Fort Bend were quick to respond and have continued to respond. We have been given guidance on what we can do to mitigate the dangers to ourselves and to our neighbors, measures like masking and social distancing. We have vaccines available to further protect us from the threat of this disease, but so much of the conversation I've heard recently has been around my civil liberties, that we cannot be made to take measures that we do not wish to take. And I will tell you, friends, that is true. We have liberties. We have the freedom to decide what to do with our own bodies. We have the right to refuse vaccination, but to insist on our liberties without fulfilling our responsibilities is not only dangerous, it is childish. In the Christian scriptures, St. Paul writes to the church in Corinth saying, "When I was a child, I spoke like a child, I thought like a child, I reasoned like a child. When I became an adult, I put an end to childish ways. Friends, we are our siblings' keeper. All of our various faith traditions that we share in Fort Bend County have common values: mercy, compassion, the sanctity of life, the need to care for our neighbors. The life and well-being of my neighbor is my responsibility every bit as much as my own life is. With the COVID numbers rising once again, as we learn more about the dangers of the Delta variant, we have the responsibility to do whatever is in our power to care not only for ourselves and our families, but for our neighbors, for our community. We must put aside selfish, childish egotism and fulfill our responsibilities. I am so grateful to Judge George, to Dr. Minter, Dr. Hotus, to our county leadership for the guidance they have offered throughout this last 18 months. And I am grateful to all of you who are doing everything that you can to protect the life and well-being of our neighbors. The COVID-19 pandemic is not going away. It does not discriminate. It does not choose. It affects us all. May we all look to our responsibilities and do what we can to care for one another. We are our siblings' keeper. We are stronger together, and together we will get through all that lies ahead of us. And so since Judge George has asked me to pray us out, please pray with me. God of all, you have created life in your image and blessed us with this wonderful gift. You have given us responsibility for each other. Let us be moved by the needs of our neighbors. Stir us up to be unsatisfied with just protecting ourselves, but give us passion to do what is needed to protect our neighbors, our community, our country. Be with our leaders making difficult choices. Be with our citizens, and help us to think on not only our liberties, but our responsibilities. Bless us all and keep us in your care. Amen.
That's why we work with pastors and faith community. They can communicate better than anybody else, I guess. And so you heard that. With that, I will tell you this. I ask your help. Those who are watching, those who are listening, I need your help. If you are vaccinated, tell your story to your family, your friends, people around, where at workplace, wherever you are. Tell your story, how safe it is and how you feel about getting vaccinated, and after how your life changed. Tell your story. And from a county standpoint, we will continue to provide the public with information they need so that they can make an informed decisions about the health and COVID vaccine, about their health and COVID vaccine. Remember, protect yourself, protect your family, protect your neighbor. Stay safe, get vaccinated, and wear masks. And always remember, life is not just about one person or just about you. It's more than that. We have a responsibility to behave in a society where we care about everybody. That's the reason why I repeat one more time. If you're not vaccinated, please participate in your own rescue. Let's help you so that we all can make a Fort Bend County good and better for all of us and our children, generations to come. With that, if you have any question, we can entertain for a couple of questions.
I will say this, Dr. Hotez is on a schedule, so if you have a question for Dr. Hotez.
Yeah, please go ahead. Yeah.
Does anyone have a question? Yes.
Yeah, doctor, please come forward.
Thank you. Channel 13. Two.
With the federal moratorium expiring over the weekend, do you think that could pose a health problem with evictions?
The federal moratorium on what? On
evictions?
with evictions?
Yes.
Well, that's kind of more of a political question. I don't know. Maybe that's best for the county judge to answer. But maybe I can help you with more of the medical or scientific ones.
For the record, that's not my question.
Oh, well, I mean, I could answer it, but it would be no more informed than any of these other good people in the room. So,
Chad go with,
yes.
Doctor, just tell us, I mean, Governor Abbott obviously has a vaccine mandate ban, a mask mandate ban. Tell me how important that is to help stop the spread of if the state was to install this, if the county was to install a vaccine mandate, would that help stop the spread? Is that something that you think would be?
I think it would. Well, certainly for the schools. I mean, that's what I'm particularly worried about because with a virus that's this transmissible, so it has a reproductive number of between 6 and 8. That means on average, somebody has COVID, it'll infect 6 to 8 other unvaccinated individuals, especially if they're not masked and vaccinated. If they're not masked and vaccinated. You know, we only have two really strong weapons, 3 strong weapons in this. One is social distancing, and nobody's very enthusiastic about going back to the way life looked like in April last year. Masks and vaccines, and so let's use them. I mean, these are incredible gifts. I mean, these vaccines are highly protective, 90% protective against symptomatic illness, so, more than 95% protective against hospitalization. We can really help the kids get through the school year, and if we don't do that, it's really hard to imagine how things go well. You've got Delta accelerating, low vaccination rates among adolescents, young adults, no ability to enforce mask mandates. I mean, what makes people think this is going to go well? So that's where we have to really push.
Channel 13.
Quick question for you. This came through Nextdoor. A lot of people are going through Nextdoor. A pregnant woman went to her doctor, said, you need to get the vaccine. I recommend you get the vaccine. She then goes on ahead and asks everybody in the neighborhood, should I get it? What advice do you tell people? Should they take advice from their neighbors? I mean, this is getting a little far-fetched here. And then it became political battle. What's your...
Well, my neighbor should take their advice from their neighbor, but that's a very unique situation. But yeah, there's an enormous amount of disinformation out there, and I use that term deliberately. Disinformation refers to misinformation with deliberate intent, and we now know there's a lot of bad actors out there who are deliberately pushing an agenda either for political reasons or they're monetizing the internet, and one of them, as you mentioned, about pregnancy. So one of the things that the anti-vaccine guys did a few years, they tried to discredit the HPV vaccine for cervical cancer and other cancers. And they made up a story. They said it causes infertility. There's no basis for it. Now what the anti-vaccine groups are doing is they're lazy. They're copy-pasting the same garbage onto COVID-19 vaccines saying it causes infertility. And the problem is we're outgunned in terms of the dominance of anti-vaccine groups on the internet. If you Google or use any search engine for the word vaccine, more often than not you're going to get garbage rather than something that's legitimate, and that's part of the problem. So, the Biden administration is aware of it, and I've had a number of conversations with them because I have a lot of experience, unfortunately, because I'm not only a vaccine scientist, but I have an adult daughter with autism and intellectual disabilities, and I wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism about my daughter, and now the anti-vaccine people call me the OG villain, which I had to look up. It means original gangster villain. So Judge, you've invited the OG villain here today to speak to the group, and unfortunately they now have. These are not mom and pop groups. These are not grassroots groups. They dominate the internet. They're well-oiled. They're well-funded. They have political action committees, and this is what we're up against. And I think we've got to be more aggressive at launching a counteroffensive against these groups who are promoting the disinformation.
We have one last question from Anna.
Thank you, Dr. Hernandez. I was wondering, with schools coming back in session, what is the risk of illness and infection to those kids who are under 12 if we can't get vaccinated yet?
It's really going to depend on how well we do as a community. Right now, if you're a parent in the state of Vermont, you can feel pretty good about sending your kid to school. Why? Because your young kid to school. Why? Because all of the adolescents are vaccinated, all of the adults, and community transmission's not going to accelerate. The problem is when you get to the other extreme, many counties in the South, where nobody's vaccinated, then Delta transmission really accelerates, and then it's going to be really tough. You know, Fort Bend is kind of halfway in between. They've done better than most, but I think the message is it's still not too late to fully vaccinate the county, and then that's the best chance we can give our kids to have a successful school year.
So Dr. Hotez, what is the plan then? If schools can't mandate masks, they can't mandate vaccines, we're starting to see COVID-19 protocols, what should schools be doing then to keep kids safe?
I would say you keep up the advocacy, things like this, to keep encouraging parents to vaccinate their adolescents, to keep encouraging everybody in the community to get vaccinated. And then the only other backstop you've got are masks. I don't think we're going to have the green light to start vaccinating little kids, at least not in the early part of the school year, maybe later on. But that's what we have. And so we have good tools. We just are not fully using them.
Thank you.
Thank you so much.
Thank you, Doctor. Thank you for being here. Appreciate it. Thank you. I know you have to get going.
And Pastor, thank you for your remarks. I was very moved by them.
We will conclude, and we all. Yeah.
We did have one viewer question for Dr. Minter about the locations where the community can get vaccinated.
I believe, go ahead. No, go ahead. You could just, if you have access to internet, you go to fpchealth.org, and that page have all the information you need where you can get vaccinated. And I don't remember the number if in case they don't have access to internet, and so you have a number to give it out?
Sure. We have currently we have 3 fixed sites. So we have our Fort Bend County Fairgrounds. We are still vaccinating on 5th Street and in HCC on the east side of the county, and we're also still at Katy Mills Mall. In addition, our mobile units are all over the county, and you can look for that on our internet. Also, you can call 832-473-1373. 832-473-1373 will give you vaccine information. In addition, we have a community that's full of places to get vaccinated, at your doctor, at the pharmacy, many grocery stores, many places throughout. We are not the only provider of vaccine. So there's lots of different places to get vaccine. If you're having difficulty, please, if faith communities are asking us to come out all the time, we are vaccinating after church, during church, homeowners meetings, back to school fairs. Just please give us a call and we'll be sure to get someone out. Doesn't matter how many people you want us to vaccinate, just a few or many, we will be able to do that. Thank you.
Thank you. With that, we will conclude, and I just say this, we are living through history, and I will ask the leaders, and I will ask the people who are putting hurdles in managing COVID-19, let's be on the right side of the history, and history is in the making right now. And so let's all get together and work together and make sure we can vaccinate as many people as we can. And we explained about wearing masks and all that stuff. Let's manage it. Let's get over it. And I have no doubt we will do that. But thank you for coming. And I especially appreciate our elected officials. You wanted to say something? Yeah, please go ahead.
I'm sorry. I had a mistake in that number. It's 832-471-1373. Thank you.
Thank you for being here. Appreciate it. Once again, thank you.